So first we will hear from Dr. Jessica Perrotte, who is an assistant professor in the Department of Psychology at Texas State University, as well as one of our faculty fellows in the university's Translational Health Research Center. We're very glad to have her. Now I will hand the conversation over to Dr. Perrotte, to get us started. Thank you.
Hi, it's so good to see so many folks popping in today. I'm Jessica Perrotte. Thank you so much for that introduction. I probably have too many slides, so I won't take too long, and I want to kind of just jump right into the presentation because I'm very anxious to hear, what Dr. Corrales has to say as well after. So happy to come today and talk about my research. My program of research at Scarab really focuses, this is very much the heart of what I focus on with my research, is linking these concepts of culture to the ways that we think about and we feel about engaging in health risk behaviors such as alcohol misuse. And then, of course, how that then in turn translates into our engagement with those behaviors. So I don't get lost in my own weeds in this presentation, I do have some aims broken out. I'm going to go over these kind of quickly here because I will be bringing them back up as we go through the presentation. But I've got three primary aims guiding my talk today. So first, I just want to give kind of this broad contextual view of what drinking looks like right now for Hispanic and Latino populations in the United States. And I'm going to zoom way out, and I'm going to give you some population-based estimates, as in like the entire United States population. And then in order to get into the third aim, I think I need to stop at the second aim, and I need to talk about, before I talk about some of the research that's been done in this area, talk about, well, what is the framework that's being used to guide a lot of this research in this area, right? So I'm going to talk about cognitive motivational theories and cultural theories. I'm going to try to do that briefly. Let's hope I can actually do that. Right off the bat, though, so most of the times whenever I talk about my research or I write a paper about my research, there's a section at the end called limitations, right? And you have to be very transparent about your limitations. But I think I kind of want to disclose some of those before I even go into this talk, okay? So some of the limitations about my portion of the presentation today are that it's mostly big quantitative research in the aggregate, right? Like I'm looking at giant populations of Hispanic and Latino folks, and there's a lot of nuance that's lost there. First of all, I'm not going to be talking a lot about, differences in trends in alcohol use and the way these factors that I'm going to be talking about maybe vary across ethnic groups, right? Like the ways that, folks who are Mexican origin might differ from folks of Colombian origin. I'm not going to talk a lot about that. That doesn't mean it's not important, right? It's just a limitation of some of the ways that I have to conduct my research. So there's going to be some important nuance that will be missing. So that's something that's a major limitation I do want to own right off the bat. Okay. So zooming in right now, let's go ahead and get into some of these population-based estimates. Now, what I've done on the first couple of slides after this is I've just done some very quick estimates of the most recent data available from the National Survey on Drug Use and Health. And this is just to give us a snapshot of what's going on most currently with Hispanic and Latino populations. And now the way that I've analyzed these data, these are representative of the US population, but they're not adjusted for any covariates like socioeconomic status or anything like that. So we're looking at raw estimates, but they are representative estimates. And so what you see here, you've got past 30-day frequency of drinking. So how often is somebody engaging in any kind of alcohol use in the past 30 days? And then past 30-day binge drinking. Right? So we see what we would expect to see. We see lower prevalence in adolescents, gearing up into higher prevalence across young adults and middle adults, gearing back down to lower prevalence among older adults. You see some differences between males and females, right? And where you're generally seeing, except for in adolescents, that males are drinking more than females. This would all be basically what we expect given given what we know about just drinking for any population across the lifespan. But then we want to also talk about not just alcohol use, and binge drinking could be classified as misuse, but alcohol use at the disordered level, right? So alcohol use disorder or AUD. So what we're looking at here are past year estimates of the prevalence of AUD among Hispanic and Latino girls and women, and the boys and men. Important to note that these are only estimates among current drinkers. So if they seem a little bit high for you, we are sampling people who have reported, I believe it's past year alcohol use within NISDA. And again, though, we see what we might expect, right? So among adolescents who are already drinking is going to be lower AUD prevalence than young adults and then middle adults. And so we see this peak in young adulthood and then this decline in middle adulthood and then older adulthood, as we would expect. And again, we're seeing the same trends across gender. But as important as it is to think about prevalence in alcohol use as far as snapshot of recent use, I think it's incredibly important to think about the trends over years. And so there's been a couple of studies that we've run out of my lab looking at the NSDA data again from the years 2002 to 2019. And I just want to highlight some of the findings in relation to Hispanic and Latino folks in the samples. So first of all, overall, fewer Hispanic and Latino adolescents are drinking any alcohol. They're drinking less frequently. They're less likely to report lifetime alcohol use, and that's great. It's important to note that the frequency of alcohol use has decreased the most for Hispanic and Latino adolescent boys than any other groups. And what I thought was very interesting with this study, it's the first citation here, is that among all groups of adolescents, it was only among Hispanic and Latino adolescents where you saw their impression of how risky alcohol was increasing. It didn't really change for the other groups, but over the years, it's been increasing for adolescents. And then also for adults, Hispanic and Latino young and middle adult men are drinking less frequently. And another thing that I thought was extremely interesting and really wanted to shine a spotlight on in that paper and then here is that out of all the groups of adults, the only group that sees a decrease in symptoms of AUD are Hispanic and Latino middle adult men, out of middle adults, and then also Hispanic, Latino young adult men. So I thought that that was pretty noteworthy. So if across all of the different groups across the lifespan of Hispanic and Latino folks, we're seeing what we might expect for drinking, and we're seeing what we might expect in terms of gender differences, and we're even seeing some really positive trends as far as reductions in drinking and reductions in AUD prevalence goes, then people might wonder, well, why focus? What is, what warrants the alcohol research here? Well, I would say all of that is just, it's warranted on its own, right? It's important for us to know, well, what are the protective factors? So what might be contributing to declines? But there's something else that I think is really important to note whenever we're talking about alcohol research among Hispanic and Latino populations are these alcohol-related health disparities. Okay, so among Hispanic and Latinos, and this is not just unique to Hispanic and Latinos, this also affects other racial and ethnic groups such as Black and African American folks, what you find is that at the same amounts of drinking, some groups are disproportionately impacted by harms related to alcohol use than other groups. And so these are some of the disproportional impacts to the Hispanic and Latino community. I'm not going to read the slide, but just highlights here, we're talking about higher rates of fatality from cirrhosis. There are higher social and violence issues in Hispanic and Latino communities that are alcohol involved, and just, and higher need for higher unmet need for alcohol treatment, often due to very specific barriers that this community faces. So there's our context. We've got prevalence, we've got trends. So let's start talking about the research that kind of goes into, okay, well, why are Hispanic and Latino folks or people in general drinking, right? So what I want to do again on the next couple of slides is just give you I'm talking very broad strokes over some of the theories that underlie the ways that I think about and research alcohol. So first of all, I want to talk about key cognitions, okay? So the ways that people think about drinking, right? So some research indicates that this is the most proximal variable to drinking, meaning right before you make that decision to drink, what's going on up here? What's going on up here? So we've got the what and the how on this slide. So alcohol expectancies are the what. What do you think alcohol is going to do to you as a person? So if I drink alcohol, do I think alcohol is going to make me more sociable? Do I think alcohol is going to make me the life of the party? Do I think alcohol is going to make me obnoxious or clumsy, right? These are positive or negative expectancies. So what do I think based on what I know about alcohol, what it's going to do to me? Motives are the how or the why, right? The reasons for drinking. Those are strong emotional and social incentives. So most motives can be broken down pretty simply in that people want to drink alcohol or they're motivated to drink alcohol if they think it's going to either make them feel better in general or like to relieve some bad feeling, right? Is it going to make them part of a group, or is it going to make them ostracized from a group? So these are some big motives, right? Then we have to think about, okay, so we've got motives, we've got expectancies, we've got alcohol over here. And so we know that these cognitions directly precede drinking. Well, what's upstream of those cognitions, right? And this is where culture comes into play. And I have to draw from this, it makes sense to me anyway, to draw from this ecological systems perspective whenever I think about culture. And I think about the systems that are surround all of us, right? So we've got at the individual level, what's our ethno-racial identification, right? We're surrounded by our family and our schools at the microsystem level, at the community level, right? We've got norms and attitudes from community. Maybe that's where we're getting like, is drinking something that somebody of my gender does, right? Things like that. And then at the macro policy level, we've got advertisements, right? We've got policies related to drinking. Is it legal? Is the legality different in one place versus another, right? Are you getting more messaging in one place versus another? So everybody's living in the middle of all of this. And there are norms at all levels of this, of course, right? And all of this is going to shape the way that somebody might think about alcohol. Now, for Hispanic and Latino folks, and this isn't just Hispanic and Latino folks, this is people, pretty much anybody who might identify as being from an immigrant population, right? And that's immigrants and their descendants. It's more complex. You've got this bidimensional or sometimes multidimensional aspect to this socio-ecological system that you have to think about. You've got norms, you've got customs, you've got values, you've got identities, you've got messaging, right? At all of these different levels, but different, or some of them are different, depending on if they're coming from what would be considered your heritage culture, right? So for Hispanic and Latino folks, some traditional or heritage Latin American culture, or from the mainstream culture. So for Hispanic and Latino folks in the United States, that would be like US mainstream culture. So you have to think about that at all of the different levels. So with that in mind, that's the broad framework. Now what I'm going to do is just share with you, let's see how I'm doing on time. Okay, I'm going to try not to go too fast, but also not too slow. What I want to do is I want to share with you a series of studies that fit within that. And these are what I'm going to share with you are studies that I myself have conducted with collaborators, but I'm also going to be drawing from some research that other folks have conducted too, that I think kind of fits into everything that we're trying to convey here. So first of all, thinking in terms of that socio-ecological system slide that I just showed, where we're talking about basically you have these different cultural orientations at all of the different levels, right, of your own ecosystem, right? What we do know from quantitative research is that cultural orientation really matters in terms of drinking outcomes with Hispanic and Latino communities, right? And overall, this is, I'm way oversimplifying here, but overall, what we find is that orienting towards mainstream US culture is associated with greater drinking, particularly risky drinking, and particularly true among Hispanic and Latina girls and women. Okay, so we see that's a very strong effect. There seems to be a gendered context here. But then what we see too is there's other research that looks at heritage orientation. Some scholars might call this enculturation, right? And it's a little bit less clear. Some studies show that that's protective, meaning that the more somebody's oriented towards traditional Latin American culture, they're drinking less. And some studies show that the more somebody is oriented towards traditional Latin American culture, they're drinking more. Some of that does seem to happen in a gendered context as well. Now, what I didn't include on this slide, because I didn't want to make it too busy, but I was like, I wanted to bring this up, just given my interest in the cognitive aspect of all of this, is that there is some recent and emerging research that shows that some of the ways orientation relates to alcohol use is through expectancy, right? And so I have a paper with some wonderful students in my lab that suggests that orienting more towards US culture actually increases the positive expectancies somebody might have about drinking. So that somebody's going to be more likely to think that alcohol is going to give you liquid courage, or, make you more sociable, make you have fun. And so it's very interesting to think about, there's that connection. But another way to think about cultural orientation, and this is some, I would say this is some even more recent and emerging research, So a lot of my work is on young adults, right? So given my interest in drinking and given my interest in these like cultural processes, young adulthood is a time where a lot of this is changing very rapidly for folks. And so one of the ways that we think about cultural orientation, or we can measure that as quantitative researchers, is what's happening online, right? What kind of online venues are people hanging out in? You know, that's social media, right? So it might be Instagram, Facebook, you know, TikTok. It could be just the messaging that you're engaging with people in a digital context, right? Like be the text messages or DMs, right? And so one of the ways that we can measure cultural orientation is through language use. So that's big. It's saying that the more oriented you are towards maybe US culture, you might use more English language. The more you're oriented towards Latin American culture, you might use more Spanish language. And so measuring that, the extent that somebody's oriented online, there's some interesting findings there. So what we're finding is that for somebody who is a later generation immigrant, meaning that maybe it was their parents who were born in a Latin American country or their grandparents, right, as opposed to them themselves, when they are pulling away from mainstream online US context, meaning they're kind of pushing away from like English speaking spaces online, we're actually seeing greater alcohol use there. And so we conducted a follow-up study on that. And what we found is that while we didn't replicate those findings from the first study, what we did find is that for young adult Hispanic and Latino folks, whenever they're orienting more towards Spanish-speaking culture, more so Latin American culture online, that's what the proxy's for. What happened is later on, they were perceiving online discrimination, both aimed directly at themselves and then aimed at other people. So we call that both direct and vicarious discrimination, right? So this is a cultural stressor that folks are experiencing when they are engaging in these spaces online. And then in turn, after experiencing the discrimination, they were more likely to cope with distress by drinking. And then in turn, they're engaging in more alcohol use. So again, this second one, the paper's not quite out the door yet, but this is one way of trying to look at this connection between cultural orientation and drinking through some of these experiences of stressors and cognition. Another important line of research goes after this concept of masculine norms. So, you know, it's not probably a surprise to a lot of people that there is an association between some forms of masculinity and drinking among Hispanic and Latino men specifically. There are two masculine norms that we talk about. Traditional machismo, right? So this is the hyper-masculine, kind of very aggressive form of being a man. And then caballerismo, which is much more like respectful and nurturing, right? And so you might go from traditional machismo and caballerismo and tie that into drinking. Like, what are the norms then around drinking that might be associated with these masculine scripts? Well, we found in some research that traditional machismo, of course, men who endorse that are more likely to think that men should drink excessively, but men who endorse caballerismo are more likely to think that men should be in control with their drinking. And that's important because, as you can see, this contributes to higher levels of problematic alcohol use for the more hyper masculine, the folks who endorse that more, and then lower levels for people who endorse caballerismo more. Importantly, more Hispanic and Latino men, way more Hispanic and Latino men endorse caballerismo and endorse these more positive ways of looking at alcohol than traditional machismo. And I bring that up because of what I had just mentioned about the declines in alcohol use among Hispanic and Latino men. And I bring that up as an important potential point for intervention or for understanding what are some of the positive processes that underlie these declines. For feminine norms, we're also looking at, these are more traditional feminine norms, but what we see, you know, the norms that Hispanic and Latino women that are being transmitted through the environment around alcohol, well, some of them do lead to less drinking. So this concept of being like virtuous and chaste, right? Which makes sense, like to the extent that alcohol is not seen as pure. But then there are other norms like family pillar, thinking that Hispanic and Latino women are supposed to be the ones like holding the family together, right? Women are more likely to drink whenever they endorse this. Or there's this other norm that not a lot of women endorse, but enough do, and there's some variability in their endorsements of self-silencing and subordinate. When they endorse that, they're more likely to drink. And again, what we found is that this seems to be happening through drinking motives. So for example, the family pillar motive, which was a surprise finding, is that it's happening through this motive to drink to be social. And so I'll show you, I'm getting to it, I think maybe the next slide or the slide after that, but there's some qualitative work that my lab's been working on that backs this up, right? That for Hispanic and Latino folks, you know, they talk a lot about, well, yeah, you have all of these family gatherings, like that's huge in our culture. And a lot of that involves alcohol, and that's okay. Like it's not, you know, it's not frowned upon within the family unit. And then for self-silencing and subordinate, what we found in a follow-up study is that a lot of women are drinking to cope with distress, right, from endorsing this value. So speaking of which, I want to talk very quickly about some of the emerging qualitative findings coming out of my lab, because I recognize that limitation in all of my quantitative research, that I'm losing a lot of the nuance there. So one of the things that I think that we really need to focus on is that and I'll say this is focused more on Hispanic and Latino women, right, given some of the extra disparities, right, that disproportionately impact Hispanic and Latino women. But just thinking about, okay, so for Hispanic and Latino women, yes, we have this understanding of what some traditional gender roles might look like in terms of drinking, but we really don't understand a lot about what mainstream US gender roles might look like in drinking, or the ways that women perceive the differences between those. And so this first question I asked folks was just, well, what is it for a woman to drink in the US? Like, what are some of the things that you're concerned about? Right. And so this first theme that's emerged is one that one might expect from a woman in the US. There's this double standard about drinking where it seems like it's okay for men to drink heavily, but not women. Right. So this is just women in general. Safety concerns. This emerged a lot. A lot of women in the US who are Hispanic and Latino are extremely worried about the risks that they place themselves at if they're out in public and they're drinking heavily, and how they need to be cautious there. And the third theme is that it's unacceptable in some circumstances to drink. Like it's not okay, you know, to kick back any drinks if you're you know, pregnant, or if you're in a caregiver role. The mixed methods work we're doing, again, that's still emerging, is we asked people, though, we said, well, is it more or less acceptable to drink alcohol for a woman in US culture versus Latin American culture? And so there's a lot of previous research that would indicate that it's more acceptable in US culture, but this is what I consider to be the beauty of qualitative oriented research, is we have some findings that really challenge that. And this is a big sample too. This is 250 people that we asked this question to and got open-ended responses, right? And so while 41% did say the US culture was more accepting, there were way more than what would be expected, 24% indicating the Latin American culture was more accepting of drinking. And some of the reasons that they talked about it were, if we go back to that socio-ecological model and think about the macro policy, some women pointed out the less stringent alcohol policies in some Latin American country, like lower drinking age, right? And a lot of women pointed out too, the family custom of drinking. Like this is a very normal thing for families to do whenever they get together and drink. And so pretty excited to get this research out more and talk more about, okay, well, these are the signals that are coming from, you know, US mainstream culture, but also the signals that are coming from Latin American culture. And so I know I'm running short on time, and I know that I sped through all this. I promise you, I even trimmed slides before I did this. I trimmed a lot of slides too. But just the takeaways, you're like, okay, I just, you know, pummeled with you with a lot of information. The main takeaway here is that when we think about, and this applies to other populations as well, but for this talk specifically, when we're thinking about drinking behaviors among Hispanic and Latino populations, right? We have to think about what are the ways people are thinking about and feeling about their drinking, and what are the ways that the ecological systems that they are nested within from both US mainstream culture and heritage Latin American culture shaping those cognitions and those motivations. And with that, it's right there in the middle, the cognitions and the motivations. Now, I'm a researcher, I'm not an interventionist, but I do know that that's a point of intervention. And so we understand how to maybe challenge those acceptances, challenge or shift those motivations. And if we can use the information that we get just upstream of that, then we could have some pretty powerful and tailored programming. So I do want to acknowledge, so a lot of this work that I did just present is supported by the National Institutes of Health with the National Institute of Alcohol Abuse and Alcoholism. I have an amazing team that's helped me out with a lot of that work and ongoing. and then also my lab. I've just got a wonderful lab full of wonderful students. So any student that had anything to do with any of the research I just presented, hope I didn't forget any, but I definitely wanted to give them a shout out. And thank you. So there's my email. That is a QR code that will link you to my lab website, which sorely needs updating, but I'll be working on that soon. And I look forward to the discussion later.